Hello, everyone, and welcome to this episode of PYA's Unscripted series. Today's topic is value-based compensation design. PYA is happy to present today's webinar on this important topic. This webinar is participation-based and uses a polling platform called Slido. To participate in the polls, you can either scan the QR code that I don't see on the screen, but will be up later, to go with your phone, or go to slido.com and enter the event code at slido.com. You may submit questions during the webinar by typing a question in the questions section of the Slido poll. We'll attempt to answer as many questions as possible throughout the webinar. With that, I'd like to introduce our presenters, Angie Caldwell and Aaron Newcomer.
Thank you, Shannon. This is Angie Caldwell with PYA. I'm a principal and spend probably 90% of my time in the compensation, valuation, planning, and design space. I do have my colleague Aaron Newcomer here with me today. We are really excited to present and share this topic with you. Before we get to the polling, we're going to have a few introductory slides, just some foundational discussion as we get into this topic. But for the audience, remember that Unscripted is a little bit of a different webinar series for PYA. So our purpose with Unscripted is to be just that, unscripted. And number two, it's really to share information. So we're going to be sharing information with you. You're going to be sharing information with us. And really the purpose is to learn from each other on the topic related to, that is unscripted. And today's topic, of course, is value-based compensation design. So with that, I'm going to turn things over to Aaron so he can walk through with us some of those foundational comments I mentioned first.
Thank you, Angie. So again, this is the second installment in our series. So the first one we did a couple months ago was on provider compensation of the future. We wanted to recap a few of the questions that apply to what we're talking about today, just to give everybody a little bit of time for their brains to warm up and to get settled. So if you look at the left side here, we asked participants what compensation types they had the most challenges with. So you'll see in that word cloud, quality is overwhelmingly the largest word there. You also see value-based payments. So that's kind of what got us into what we're talking about today, made us want to dive a little bit deeper into that topic. If you look at the right side, we asked about components currently included in participants' compensation models. That first green bar is base compensation, so almost everybody uses that, but I want to point you to the quality and engagement incentives towards the middle of the bars. So 63%, about 2/3, said that they currently include that component in their compensation models. The next questions that we asked about, so on this left side, and these are my favorite ones with the emojis. I always like to see these. If your organization's current quality and engagement incentives are effective. So most of the people falling in the middle there, kind of meh is how I would describe that. But surprising is to the right, we've got about 8% that are happy or overly pleased with their incentives currently. Most of them are displeased, or I don't want to say distraught, but that far left emoji. That's how that one looks. A little bit more positive, this question on the right, we asked if engagement, quality and engagement incentives align with organizational goals and metrics, and about 2/3 said yes, some of them. So that's a little bit brighter on that note. The two pictures here that you'll see both relate to the same question that we asked last time, and we'll get into some similar questions here in a little bit. But we asked about the percentage of base compensation at risk for quality and engagement incentives, and you'll see about half, that blue bar, about half said 0 to 5%. In the bottom right, you see another little word cloud. About participants said that the ideal percentage in their mind was about 20 to 25%. So you start to see a little bit of a gap between what we're going to call the current state and maybe the ideal or future state, and we're going to talk about that a little bit today as well. Before we get into the questions and before I hand it back to Angie to talk about how Slido works a little bit, we wanted to define value-based compensation because that's what we're talking about today. So value-based compensation really is linking the value that's provided to the compensation by using incentives. So when we say value, we mean the amount of improvement in whatever the measurement is or the associated cost of it. So that measurement, it can be a clinical outcome, it can be a cost measurement, but we're trying to increase value for a lower cost, essentially. But when you think about answering these questions today, we're not, when we say value-based incentives or compensation, we're kind of throwing out the work RVU based, the encounters, the collection. So put that section of your brain aside for a little bit.
All right, so let's talk about Slido. If you were with us last time, you're old hat at this, you're an expert, you know how this works. If you weren't with us last time, remember that Unscripted is designed to be interactive. So we will be interacting with the audience and you'll be interacting with us throughout the remainder of the webinar today. So you join at slido.com and enter the code on the left or use the QR reader. And we've got a fun warm-up question on the screen. Which do you prefer, dogs, cats, or both? And so this was a fun one, and we'll kind of watch and the answers come through on the screen here. But while we're doing that, before we get into some of the more detailed questions and topic-specific questions around value-based compensation, we recognize that our audience is full of different people from different organizations in different parts of the country. We have a lot of our consulting firm colleagues in the audience as well. And so we're asking, as we get into the topic-specific poll questions surrounding value-based compensation, please only answer those questions if you have direct experience and knowledge around the question. So because, of course, we're trying to learn from each other. And so if you don't have a perspective and just answer, then the learnings and the key takeaways from our polling session today won't be as clear or as good. We also recognize that our audience has both managers and professionals and executives from hospital systems as well as private practices. So throughout the course of our presentation today, we will try to address the topic from both a hospital system perspective as well as from a private practice perspective. So from our first poll, we see that 75% of you are dog people, 15% are both, and we've got 9% that are cat people. So this is a fun way to warm up, and we appreciate you playing along with us to get used to the polling and the polling software today. So with that, let's get into this. Our first topic related question for today's session is, does your organization use value-based provider compensation? So not applicable, yes, or no. And we'll give a few seconds here and let people respond. You know, in a private practice, of course, value-based compensation is coming in differently than it does in a hospital and health system, in that the practice receives that value-based reimbursement, and then that value-based reimbursement is then distributed based upon whether the private practice is a physician compensation plan or perhaps they have a different methodology solely for value-based reimbursement. And so this question, you may have value-based provider compensation, but clearly it would flow through your organization differently than it would to physicians in a hospital or health system. So it looks like about 41% of our respondents do use value-based provider compensation. And
I'm
about
a little bit surprised on that, Angie. If we thought about the recap we just did, and 63% saying that they used it, so it's dropped a little bit from then, maybe just the mix of participants, but it's interesting to see that split.
Yep, absolutely. And you know, 27% in a, you know, again, they might be other consultants that are attending today, or perhaps others in the industry not directly involved with provider compensation, but interested on the topic. And so let's go ahead and move forward to the next question. What is your organization's philosophy regarding value-based compensation? So this type of poll is a word cloud. So we expect that your responses may come in a little bit more slowly on this one, because since the responses, it's not a multiple choice. But what we're looking for here is, you know, an overall or general philosophy regarding it. And it could be as simple as just a few words that, like what just popped on the screen. You took the words out of my mouth, whoever said supports. And these are great that are coming through, because it is important from a strategic perspective as it relates to value-based compensation to really have a strategy. And then that strategy is defined by the organizational philosophy regarding value-based compensation. And so these words that are coming through, growth, that's a great philosophy, because you're thinking about how is our organization going to grow? How is our organization going to change with the times, if you will, as value-based reimbursement continues to increase? Return on investment, absolutely. Our organizations, or your organizations, are making big investments in value-based metric measurement and in all of the things that are required to contain costs. And so it is considered a return on investment, for sure.
We see almost as many words as we have participants in there, which isn't surprising, because it's really not a one size fits all. So I was curious to see how big our word cloud could get, and it's getting there.
Yeah, I really like this a lot. I see win-win. I see leery of it. You know, thank you for that transparent response. And speaking of transparent responses, this is great input. So I don't want to go off this slide just yet. Speaking of, you know, hesitant or leery, please know that we're using Slido and the Slido process today because your responses are confidential to us in Slido. So while we know who's attending today based upon the registration through GoToWebinar, your responses through Slido are confidential. So please feel free to share information. So thank you for this. This is great. And there are a couple of people still typing, and I don't want to be rude. I'll go ahead and move on. And if you want to add your comment from the word cloud into the chat in GoToWebinar, we can add it to the responses later. So our next question is, does your organization participate in value-based payer arrangements? So we're switching the side of the fence for you now. We first asked about value-based compensation, and now we're talking about value-based payer arrangements.
And we're kind of hinting at the link between the two. It's hard to talk about one without talking about the other. So it may not be the only question in that perspective.
Yeah. And it's interesting because this response is, the NA responses here are closely aligned from a percentage perspective to the other slide as to whether they used value-based compensation or not. So for those that are thinking about the results to the polls today, about 19% of the folks in the audience are perhaps other consultants or in other industries and just interested in the topic. But the other 79% of the participants today do participate in value-based payer arrangements. I'm guessing everybody participates in Medicare, and they're probably treating, and no, Medicare does have some value-based payer elements with it. So that's terrific. So next slide here, what percentage of your payer revenue comes from value-based reimbursement? So this is a hard question, and it might be something that you haven't really thought about before as to, you know, how much, and what we're getting to here is what percentage is fee for service, what percentage is then value-based.
And I'd be surprised if we see a more than 50% answer. If we do, I'd love to hear more about it somehow, but we can see most of them are under that percentage.
Terrific. So we've got about 68% of our respondents say that about 10% of their payer revenue comes from value-based reimbursement, and then it's scattered out, but no one is in the more than 50% mark. Those that are in the 25 to 50% mark know that you're on the right side of the continuum. You are on the higher side of that, and that's terrific. And frankly, based upon what we're seeing in the industry, that's where everybody's headed. We've had a bit of a slow go at it, getting started and getting headed in that direction, but really that's where everything's going from an industry perspective. All right. Rank the provider types according to use of value-based compensation. One being that you use value-based compensation in this specialty type the most. 5 being you use value-based compensation in this specialty type the least. Give everybody just a second. So I have an expectation that will be coming from the answer to this question. So I'll go ahead and put myself out there like I'm doing a crystal ball or something, but I'm expecting that advanced practice providers and the providers with administrative duties, it's happening now, will be at the lower end of this simply because it is more difficult perhaps to work in value-based metrics and measures into those types of arrangements than perhaps the others, because the others are, there are a lot of things that you can tie to those arrangements from a value-based perspective. And again, you're looking to modify behavior and enhance engagement and citizenship through these metrics. So it's not surprising to me at all that primary care, who directs so much in the physician space from a flow of patient perspective, is coming in first.
And Angie, I do wonder if it has something to do with the value-based reimbursement as well. So certainly surgical specialties have some bundled and episodic payments, but in terms of primary care, at least from what I've seen, there's a lot more participation in shared risk, shared savings. And so I wonder if that's flowing through to the compensation as well, because that was what I sort of expected to see.
Yeah, absolutely. We'll move on to our next poll. So I know at the top of the presentation today, we said, we know we've got a lot of different organization types in the audience. If you would please, for us, just indicate your organization type. Health system in the audience is, of course, the highest that we have. Other, that percentage, I've got an expectation for the other percentage that'll go along with the other couple of slides, indicating perhaps others in the audience. Very good, thank you for that. Okay, so we've got the emojis, the fun emojis at the bottom here. How do your providers feel about value-based compensation? And when I first saw this question, I thought, well, we're asking people to tell us how people feel, and maybe that's not fair, but I'm sure based upon the conversations that you have with your providers within your organizations, you probably have do have a very good sense as to how these physicians feel about it, whether they are, as Aaron so aptly described with the emoji with the straight line mouth as meh, or perhaps they are overjoyed with the value-based compensation that you currently use.
And I'm pleased to see this a little bit more towards the middle, and even on the right side, we've got a few more people, because I think sometimes when we talk to physicians and the people that work around physician compensation, there's at least an initial barrier of hesitancy. So if it's something you use and you're used to, maybe you feel okay about it. And if it's something you don't use, you maybe feel a little bit apprehensive about it.
So the overwhelming majority of our participants today said, meh, about 60% of our attendees. And so hopefully today, with the information that we're sharing, as well as the information that you're gathering from other audience members, hopefully we can move that more to the right with some of the things that we're going to talk about today, and that we might be able to draw out in some of the remaining questions. So, do you believe, audience, that value-based compensation would help with provider retention? Yes or no? Poll results are interesting on this one. So we've got 72% currently saying no, 27% saying yes. So while some additional results are coming in, I'm going to comment on this one. I actually thought going into today that the answer here might be reversed. And here's why. So, of course, we all know that there's a lot in writing and we hear in the industry about burnout, physician burnout, and of course, supply and demand issues. And so with a proper value-based compensation strategy that focuses more on outcomes rather than volume and procedures, could an argument be made that a properly designed value-based compensation strategy help an organization retain physicians through that feeling that, again, the physicians are a part of something bigger? You know, they're really helping to drive the health of a population or their patient panel. And so it's interesting, and maybe I'm a little bit of a glass half full on this one, but thinking that a properly designed value-based compensation strategy may help with retention.
I was similarly optimistic, Angie, so I'm surprised as well. And it almost gets into the kind of industrial psychology section of how you think about it and how it influences physicians' behavior and their mindsets and their perception on it. But I was surprised to see this split the way it was too.
Let's move on. For your providers that receive value-based compensation, what percentage are employed as opposed to independent contractors? So what we're getting to here is we are thinking about, because value-based compensation is not just for your employed physicians. You can work value-based compensation into financial assistance arrangements, call coverage arrangements, medical directorships, really all of the things. And so this question is really getting to that, to see, you know, who's getting the value-based compensation.
And my experience with this, when we do see it with independent contractors, it's usually a large group of independent contractors that are maybe working in a hospital-based specialty. I think it's hard to get buy-in if you do have a single independent contractor, depending on what the specialty is.
Exactly. Erin, I'm going to let you read the next questions. And so I'm going to turn it over to you.
Yep. Thank you. So this one, in general, what percentage of base compensation does value-based compensation currently represent? So this is similar to a question that we asked previously, so I'll be interested to see if the results are the same. We specified base compensation here, so if you're doing the math, make sure to use that. And if you're like me, you're probably doing the math in your head and then also doing it on your calculator to make sure that you don't put in the wrong answer.
And then if you're like me, you're calculating it again because you're afraid that you've fat fingered something on the calculator on your phone to figure out the percentage. So the answers are coming in line with what we received last time in our last polling session, and that's terrific. And that most of you are indicating that the percentage of base compensation at risk for value is about 0 to 5%, and about 50% of you are in that category.
And it was 47% last time, so not a huge change in those answers. There were some greater than 20%, which I'm pleased to see because I wasn't sure if that would come up or not. So I'm glad there's a few of you out there with that. We're gonna move on to the next question. So how much do you expect your value-based compensation to increase in the next 3 years? So we're asking you to kind of forecast and kind of estimate here. It's not going to be, an exact percentage, but we've got some ranges there. We do expect to see some increases. I know I had an ask recently, Angie, where we had discussed an arrangement that had about 50,000 at risk for a physician, and they came back to us a couple years after, which was a few months ago, and wanted to increase that to 150,000. So that's tripling it, and I don't think that's common per se, but if you do use it and it's working well, I could see it increasing a lot going forward. If you don't use it, you kind of have to ease into it. It's not going to go from 0 to 50% in a year or two.
Yeah, so this is very interesting to me because, we're asking about this from an increase perspective. And I love to see the magenta colored pie up there, that 11%, where we've got some folks in the audience are saying that we are moving, as an organization, we are moving to more at risk for value, and we're going to up that by at least 15% in the next 3 years, and that's terrific. And perhaps aggressive, but in this industry and where we sit today from a value-based reimbursement perspective, it's entirely appropriate to begin moving more to that at-risk bucket for value.
And when we look at some of the survey data, benchmark data out there, and if we look back across the last 3 or even 5 years, it's a little bit stagnated. And so we want to see these responses looking at some increases. It hasn't changed probably a material amount in the past few years. So moving on to the next question, do your physicians feel they actively influence the outcomes for the value-based metrics for which they are compensated? So this might be a big insight for us into what those smiley faces and emojis looked like, because if the physicians don't feel like they have control over this, they're going to feel meh about the incentives and the dollars themselves.
And I'm sure many of you have had the conversation with the physician about the performance-based, value-based metrics within their agreements, about perhaps how they feel that they don't influence the outcomes. For example, one of the measures that I've had a lot of pushback on, or heard a lot of physicians talk about, is in anesthesia, and particularly on-time starts. So while the anesthesiologist is in control of that to an extent, there's a lot that has to happen in that surgical suite in order for that on-time start to occur. The other surgeon has to be there, the room has to be ready, the staff has to be prepared, all the correct equipment and tools have to be ready. The patient has to be ready from a preparation perspective. And so there are a lot of things that go into that aren't in control of the anesthesiologist, just as an example of one that is difficult to point and say who really controls that metric.
Well, and if you add the sometimes and the yes categories together, we're getting close to 75%. So that looks good. I've heard similar comments on, patient satisfaction. So that's maybe one that we've got down kind of the measurement for, that's been out there for a while, but some physicians don't appreciate that metric because either there's multiple touch points for certain things where you might see one physician one time and another physician another time, or just, if you have a bad day on the way to your appointment, that could go into it.
Yeah, I used to think that the patient satisfaction score was maybe a gimme when it came to value-based compensation as a metric, but over time I've actually gained quite an appreciation for that metric, that it is a bit harder to get to the threshold for achievement of the metric than I originally thought. Because like you said, Aaron, so many things can happen. And from a patient perspective, the patient encounters so many other things prior to seeing the physician. So, the patient is answering, while the question is geared towards the physician, the patient is probably answering about everything else, whether the office was too cold, or the paper on the exam table made too much of a crinkle sound when they sat on it. They're taking all of those other things into account.
Exactly. I mean, I hit construction on the way to the office this morning driving in, and I had a call with Angie that I was a couple minutes late for, and she could tell that I was frazzled when I got there. So there are a lot of things that go into it.
Yeah, sure.
So moving to the next one. What measures are used in your value-based compensation? So this is a select all that apply, and we touched on a few of these measures earlier, that all of these can come up when we talk about value-based compensation and how we measure them. And there's patient satisfaction that we were just touching on. I wanted to talk about the citizenship a little bit, the one down there towards the bottom right now. Sometimes we've seen that as a gate or a door where physicians have to meet certain citizenship metrics. They've got to attend their meeting, submit their documentation, get their flu shot, other things like that. And then maybe it opens the door to other value-based metrics, and maybe there's more dollars associated with those. So I don't know which ones, Angie, you've seen most often in this list.
It's not surprising that the answers are coming out as they are. Clinical quality, of course, is, I'm not going to say that it's easy to measure. I'm just thinking about the metrics that are measured or recommended to be measured by Medicare. Provide us a nice roadmap for certain metrics around and surrounding clinical quality. Patient satisfaction has been around for a very long time, and of course we talked about how maybe that's a little harder to achieve than what we originally thought. I think cost or financial metrics are only going to increase in importance if we think about value-based compensation as a strategy and tying it into the overall organizational mission and vision. I think cost and financial is only going to continue to rise. I'm happy to see that about 53% of the time this is a metric that's being used. And again, I think it's only going to increase in importance, especially as margins within physician practices as well as hospitals and health systems just to continue to get more narrow. That I think this is one too that payers are looking for. If we think about the quadruple aim, this is one of the things: high quality and lower cost. And so we're definitely hitting on the high quality with our metrics currently, and over time we're going to focus more on that cost.
Yeah, I think the cost or financial is something the payers are definitely focusing on, and I know that some of our audience now is in private practice, and I think that's maybe come through more there. If you're employed by a hospital or health system, it's sometimes harder to integrate those cost and financial metrics, but I do think we'll see more of that going forward. So into the next question: do the metrics you have selected for value-based compensation aligned with organizational missions and key performance indicators? So we definitely want these to be aligned, but you're not necessarily putting them together at the same time. So if you're thinking about value-based compensation metrics for physicians, you probably already have an organizational mission and certain indicators. So you kind of a two-part process. But the analogy I think about in terms of the alignment, when I was getting my 18-month-old son ready for school this morning, and I was trying to get him dressed and put his clothes on, and he wanted nothing to do with it. He was running around the house, he was playing, and so it took much longer than it should have. And if you think about the alignment between these physician metrics and these organizational goals, if they're not aligned and if they're not everyone working together, then they're going to take a lot longer to achieve, or they're going to be harder to achieve. So sometimes it forces us, I think, to bring a broader group into who's determining these metrics, just so you get the appropriate perspectives of how to align them.
Yeah, so the poll results are interesting. Yes, about 45%, sometimes 45%, which to me indicates that overall we're trying to align with the organizational mission. And I think if we get back to my glass half full philosophy of that, can a value-based compensation strategy help with retention and recruitment of physicians over the long term? I think, again, tying these and aligning these and making that physician feel part of that greater whole or that greater good within the organization may help with that.
And I'm a little bit surprised, but happy to see 0% saying no. I mean, there's some NAs and some I don't knows, but I'm happy to see that.
Yeah.
So the next question is similar, but do the metrics you have selected for value-based compensation align with payer metrics for value-based reimbursement? So again, we're thinking about the payer metrics and the provider metrics. And if you think about kind of the flow of a dollar, you can say it starts with a patient who's paying their premiums, but it's coming from the payer. It's going into either the hospital or health system or the practice, and then coming through to the provider's compensation. So when we think about the alignment and flow of that dollar, we want the metrics to have a similar alignment. But again, there's a lot of pieces to try to put together and a lot of people that have to work to get that to that point.
And I think it just sometimes makes sense to align the payer metrics with the value-based metrics for compensation. One is from an administrative standpoint. You're already measuring those things. And so you should already have all of the processes in place and the data in place then to be able to measure it. So it looks like about 82% of folks in the audience agree with that we're already measuring. So why not just pull it right on through into the physician or into the provider's arrangement as well.
And again, 0% at no is great to see. People are already doing the right things here. So I think this might be our last question. This is another word cloud. What is stopping your organization from placing more provider compensation at risk for value? And again, these responses are anonymous, so we want feedback as honest as you can be or want to be. We want to see all of that as the responses come in.
Takes a little longer for responses to come in when you have to think about the words that you're going to use in the cloud. And so I think while the answers are coming in, I have a few comments to share, and just from my experience. And some of them are actually coming through on the screen already, just like happened to me last time. But when this idea of value-based compensation came forward in our industry, I think as provider compensation professionals, we rushed to put performance and value-based measures into provider contracts and arrangements really before value-based payer reimbursement was in place, or perhaps when it was at its infancy. And we rushed to do that really without some of the education, the cultural foundation setting, some of the the change management aspects of all of that needed to occur. And in doing so, we created a little bit of a confusion, perhaps, of why are we doing this, and perhaps selected metrics that weren't entirely meaningful to the physician, which in all that our physicians have been through in the past few years with the pandemic and with EMR system upgrades and integrations and all the things, it was just another thing for them to be frustrated about. And so now, as more payer reimbursement is shifting to at risk for value, I think that we have some re-education and realignment to work through with our providers to kind of reassess and reinforce why this is important, and why we are doing it. And so one of the biggest things on the screen right now is retention. So retention is actually stopping them. And I think, and I guess that's a little bit of a surprising response to me as well, but very important. And I'm guessing that's because of the fear that compensation will decline if more is at risk for value-based incentives, and the recruiting environment and the supply and demand environment is such that you have to be able to keep your physicians and keep them from going someplace else where they are paid more on a productivity basis instead of on that value-based system. So that's interesting.
And I think as important as the cultural shift and the education is the infrastructure as well. I mean, we see uncertainty with data, difficult to track. There's certainly some time lags in these type of metrics as well. And so as physicians think about their compensation, they want to be able to tell if it's going to go up or down or stay the same. And they're used to metrics like work RVUs and things like that. And so as new metrics are introduced, you have to make sure you can track them in a reasonable time, in a transparent way, so that providers can understand, what is affecting their compensation and what they should be working towards.
Yeah, and I really appreciate the comment too that physicians want guaranteed compensation. Aaron and I hear that probably every day, that the more an organization can put not at risk or guaranteed, the more likely you are to have a happy physician from a compensation plan perspective. We're not endorsing that necessarily. There is some risk with putting additional compensation or having additional guaranteed compensation for physicians, but we do understand the pressure out there in the industry to do that. It would be interesting. We can't today, but it would be really interesting to see how the answers to this question broke down between hospital employed or hospital health system participants today and private practice folks today, because I know that in many primary care practices across the country where they have entered value-based arrangements with their payers, it's been lucrative for those practices to be able to do that. And once they're able to understand, gear up, align, and work within the, what the contract is asking them to do, it has elevated physician compensation substantially in those practices. And so, those practices may have answered differently. They may have answered more with a burnout, gosh, they still feel like they're chasing something out here from a contract perspective, or another answer. So very good. Is that our last question today, Aaron?
Yes, I believe it is.
Terrific. So everyone, we really appreciate you. And before you sign off, please know that one of the benefits of attending Unscripted is that we gather the information that you have shared with us and we have shared with you during the course of our 44 minutes together today. And we package it in a way that you can have it and refer to it going forward. Because again, while there are articles out there written on this information and perhaps other survey data, Unscripted allows you real-time access to your colleagues and others in the industry related to this information, and helps you and us think through these really tough topics as it relates to compensation matters and compensation design elements. So we'll be packaging that up in the next couple of weeks and sending that out to our participants. We really appreciate you today. Thank you for joining us. I'm going to turn things back over to Shannon Smith to close us out.
Angie, thank you. Angie and Aaron, great information today. We appreciate you guys presenting this great topic. Later today, all of you will receive an email with their contact information and a recording of this webinar. And all information on this and future episodes of PYA's Unscripted series are available on the Insights page at PYA's website, which is pyapc.com. While you're there, go ahead and register for some other PYA webinars and learn more about the full range of services offered by PYA. Please remember to stay on the line once this webinar disconnects to complete a short survey and post any questions you may have. On behalf of PYA, thank you for joining us and have a great rest of your day.